Now, the minority in Parliament continues to mount pressure on government to back down on a decision to possibly increase taxes and the introduction of new ones. The CEO of the National Health Insurance Authority, Dr. Samuel Ano, is making a strong case for a VAT increase from a component which is 2.5% to 3%. That's not all. The NHIA is also pushing for the introduction of a health tax where consumers of sugar, tobacco and alcohol will be made to pay more. Dr. Ano, in an interview with JoyNews, assured the right internal mechanisms are in place to ensure the additional funding will be put to proper use to save the ailing scheme from collapse.
Administrative cost doesn't go beyond 12 to 13%. Because if you look at the pressure on you to pay claims, there's no way you can spend 40% just on administrative costs. So we're sitting at 12, 13%. And we believe that if the funding gets improved and we are paying all the things we are supposed to pay, paying for patients who are admitted, paying for surgical procedures, where our budget will improve from about 1.2 billion to maybe about 3 billion or so, the administrative costs will drop to the normal standard of about 8 to 10%. So we believe it will come down going forward. It will not go beyond this high level of 12, 13%. It is high because at the moment we are not paying for a lot of things, and that is why the administrative cost is seeming high. The same administration will be used to administer even the higher funding for a higher number of people, and the administrative cost will come down.
But are you telling us that all the proposals that you've made to government by Thursday, hopefully, if that goes through, even with all the pressure that is piling on government, would that be the end it all, a be it all for the NHIA?
I think it will bring a significant change into the National Health Insurance Authority. It will be a major shift, a major paradigm shift from where we are now, from when we started the first 8 years when everything was fine, or the first 4 years everything was fine, we didn't owe, we had reserves. To the point where we are owing everybody and people are being thrown out of hospitals and people are chased to pay money here and there, to a point where we'll be able to stop all these unauthorized payments. We'll owe no one, we'll have reserves, we will have made a big paradigm shift.
Okay, how much exactly are you expecting?
We're expecting from what we say that we need a minimum of $86. To provide slightly better care, we need $100. Somebody says he's not happy when we quote the thing in dollars. You might as well say we're looking for 500 cedis a year for every person. That is how much it costs on the international market. 500 cedis. Okay. 500 cedis per person for a whole year. That is how much it will cost us to buy health as everybody does and give proper care. And once we're able to reach there, it will take time. What will happen, we don't expect to move from 110 cedis to 500 cedis just by a magic band. But at least moving from 110 cedis, we'll get to 250 cedis, we'll get to 350 cedis. Slowly, we will get to the 500 cedis per person.